Hello everyone, my name is Dr.Madhu Azad. In this video, I am going to talk about diarrhea. Actually, there are so many cases of diarrhea which is happening in Tirupati. So, let's discuss why this diarrhea is happening, what is the cause behind it, what are the symptoms of diarrhea, how you can manage the diarrhea at home, and how you can prevent it from happening. So, let's get started. So, what is diarrhea actually? Diarrhea means watery stools more than 3-4 times a day. It can be with blood also, and it can be with mucus also. When it is with blood, we call it dysentery. And along with the diarrhea, there can be vomiting. There can be fever. There can be severe stomach pain also. So, what does this happen? Why does diarrhea happen? It can happen because of bacteria. It can happen because of virus and because of parasite. The bacteria like Salmonella, Shigella, etc. There are several bacteria which can cause diarrhea. Virus like rotavirus, parasite like amoeba, entamoeba histolytica, giardia. And how this is microorganism, these bacteria, viruses enter into your body through hands. Because of the dirty hands, if you eat with these hands, this enter into your body. When you are drinking the contaminated water, when you are drinking the contaminated food, then this goes into your system and the person can have diarrhea. Why this diarrhea is so severe? What can happen because of this diarrhea? Because of the water loss. Along with the water, the electrolytes are lost and the body is going into electrolyte imbalance. And because of this electrolyte imbalance, you can go into dehydration. The kidneys can fade also. And when it is very severe, when it is uncontrolled, the person can die also. So the management of diarrhea is very important. So because of diarrhea, the person can go into dehydration. So we must know the symptoms of dehydration. It can be mild and it can be severe. In case of mild dehydration, we can manage the person at home. But in case of severe dehydration, the person needs to go to the hospital. So what can happen in mild dehydration? The person can be very thirsty. The person can pass urine at long intervals. The mouth will be dry. See, the water loss is there. So the person will be asking more water. So the thirst will be more. The mouth will be dry. The tongue will be dry. The skin will be dry. If you pinch the skin, it will go slowly. And the extremities, these hands, the legs, they will be cold. So these are all the signs of the mild dehydration. Now I am going to tell what are the signs of severe dehydration. It is very important to know. See, in severe dehydration, the person will be very tired, lethargic. There is no energy. There will be no thirst. The mouth will be very dry. There will be that the person has not passed urine for a very long time. The extremities are very cold and the eyes are very, very deep into the sockets. And there will be absence of tears also. In case of the child, if a child is crying and there is no tears, that means the child is going into the severe dehydration. And if they pinch the skin, normally it is going like this, very fast. But in case of severe dehydration, it will go very slow. Now I am going to tell you how we can manage a person at home in case of mild dehydration. It is very important to know whenever there is diarrhea, you must give the person ORS. It comes in the form of packets. It comes in the form of powder. Not the juices ones, not the liquid packets. Those are not ORS. You buy the packet ones. Boil 1 liter of water, cool it down, mix 1 packet of ORS in that and drink it in sips. And when you are passing the stool, every time you take large quantity of ORS after passing the stool or vomiting. What other fluids you can take are coconut water, very important, lemon water, buttermilk, normal water, vegetable soaps. So these all will balance the electrolytes in your body. Diarrhea can be managed at home if you manage the dehydration at home and the person cannot go into severity. So these management is very important whenever there is low stools. Now I am going to talk about how you can prevent diarrhea from happening. Hands. Before eating and before feeding the child, you wash your hands. This is very important because the microorganism is going through these hands. Eat home cooked food, clean food, and drink clean water. See, the contaminated food and the contaminated water. The microorganisms are going through these two sources only. So eat home cooked food and drink clean water and wash your hands. This is very important, and this is how you are going to prevent loose stools or diarrhea from happening. There are so many highly effective medicines in homeopathy which acts very fast in cases of diarrhea. If you want to book consultation with me, you can WhatsApp me on the given number. Hope this video helps. Stay safe, stay happy, and stay healthy. Thank you so much. Bye-bye.